matching where they are and slowly changing the music. So that said, do you have any other comments about this experience for you? Nursing has evolved, nurseries have evolved, and during the past 70 years, babies are surviving at much earlier rates, much earlier ages gestationally. As we know, the gestation of a baby is about 40 weeks. Our babies are sometimes born at 24, all the way up. So anything under 37 weeks is preterm. And a lot of the babies in the NICU are preterm. Some of them are small for gestational age, and all of these children have very specialized medical needs.
All contribute something. It's something we can work on over a period of time. A lot of times they bring in a favorite song, and then we just change the words to make it meaningful to their family, add verses, make it personal. And this is something we can work on over time. It's something we've done. I had one dad who wanted to do like 5. I mean, he was so gung-ho. It was so precious. He was like, and how about this? And his daughter had a really unique name, so it was really hard to figure out how to fit her name in a lot of the songs he wanted. I was like, all right, but we figured it out, and he ended up writing like 4 or 5 songs for her. And that was something he could do, because, you know, for the dads, it's so hard sometimes.
So what I kind of wanted just to speak with you about today is what defines a low risk versus a high risk pregnancy. What are some of the medical things that we deal with and some of the interventions? And I hope that in the work that you do, this will stimulate you to think of new ways that you might offer the services that you have for patients and staff. And, you know, there's a lot of converging disciplines. There's a lot of teamwork in medicine now, and I'd like to just sort of talk about the collaboration of all the different kinds of services that we have to offer.
So I wanted to give you some concrete tools on how to approach patients in dealing with tough times. These are some mantras that we like to use in social work, so you can use them.
I'm going to talk about both the pharmacologic and the non-pharmacologic management, and then the team approach, which you've heard from many of our previous speakers, which of course really is relevant to every aspect of not only medicine but life, really. But I'll talk about it in terms of what who our team is in the NICU.